Hello, welcome to my YouTube channel. Today we will focus on effects of diclofenac on client with chronic kidney disease. Introduction to diclofenac and CKD. Diclofenac is a potent non-steroidal anti-inflammatory drug, NSAID, commonly prescribed for pain, inflammation, and joint stiffness. While highly effective for musculoskeletal issues, it poses a significant risk to renal health. In patients with chronic kidney disease, CKD, a condition characterized by the gradual loss of kidney function over time, the use of diclofenac is generally contraindicated or advised against with extreme caution. The primary concern is that kidneys in a state of CKD are already struggling to maintain filtration and fluid balance. Introducing an agent that further impairs these processes can lead to irreversible damage. The mechanism of renal injury. To understand why diclofenac is harmful to the kidneys, one must look at the microscopic level of blood flow regulation within the renal system. 1. Inhibition of COX enzymes. Diclofenac works by inhibiting cyclooxygenase, COX-1 and COX-2, enzymes. In most parts of the body, this is beneficial because it reduces the synthesis of prostaglandins, which are the chemical messengers responsible for pain and inflammation. However, prostaglandins also play a housekeeping role in the kidneys. 2. Disruption of normal hemodynamics. Under normal physiological conditions, prostaglandins, specifically PGE_2 and PGI_2, act as local vasodilators. They target the afferent arteriole, the intake pipe, that brings blood into the functional unit of the kidney, the glomerulus. By keeping this pipe dilated, prostaglandins ensure that the kidney receives enough blood to filter waste effectively. This is known as maintaining renal perfusion. 3. Vasoconstriction and GFR drop. When diclofenac suppresses prostaglandin production, the protective vasodilation of the afferent arteriole is lost. The result is vasoconstriction, narrowing of the vessel. This leads to a dangerous cascade: reduced renal perfusion. Less blood reaches the kidney. Reduced glomerular filtration rate, GFR, the filtration pressure, drops, meaning the kidney can no longer clean the blood at a normal rate. Worsening function. The lack of blood flow can lead to ischemic injury to the delicate renal tissues. 3. Clinical effects in CKD patients. For a healthy individual, the body can often compensate for a temporary drop in prostaglandins. However, for a patient with existing CKD, the effects are far more severe: acute kidney injury, AKI, a sudden, sharp decline in kidney function that may require hospitalization or dialysis. Progression of CKD. Repeated use of NSAIDs can accelerate the transition from early-stage CKD to end-stage renal disease, ESRD. Fluid retention and edema. Because the kidneys cannot filter sodium and water effectively, fluid builds up in the tissues, often visible as swelling in the legs and ankles, edema. Hypertension. The retention of fluid and the constriction of blood vessels naturally lead to increased blood pressure, which further damages the kidneys in a vicious cycle. IV. Identifying high-risk groups. Certain populations are at an even higher risk of experiencing nephrotoxicity, kidney poisoning, from diclofenac. 1. The elderly and vulnerable. The elderly naturally have a lower baseline GFR. Additionally, those suffering from dehydration or heart failure rely heavily on prostaglandins to keep their kidneys perfused. In these states, taking diclofenac is like turning off the tap for a kidney that is already thirsty. 2. Dangerous drug interactions, the triple whammy. A critical clinical warning involves patients taking a combination of medications. The risk of renal failure skyrockets when diclofenac is taken alongside ACE inhibitors, ARBs. Often used for blood pressure, these drugs dilate the efferent, outgoing, arteriole. Diuretics. These reduce overall fluid volume in the body. When you combine a diuretic, low volume, an ACE inhibitor, dilated exit, and diclofenac, constricted intake, the pressure inside the kidney collapses. This is known in the medical community as the triple whammy. Versus clinical significance and safer alternatives. The clinical takeaway is clear: diclofenac should be avoided in moderate to severe CKD. Healthcare providers must screen for renal history before prescribing NSAIDs. The preferred alternative, paracetamol. For patients with CKD who require pain management, paracetamol, acetaminophen, is usually the preferred analgesic. Unlike NSAIDs, paracetamol does not significantly interfere with renal prostaglandin synthesis or blood flow, making it a much safer profile for those with compromised kidney function. Thank you.